Good afternoon. Thank you for joining today's webinar on innovative programming for veterans in the criminal justice system. My name is Mark Stovall, and I'm a Senior Policy Analyst at the Council of State Governments Justice Center, and I will be moderating today's webinar. To give you an overview of today's webinar, first we will do introductions of the panelists, then hear about the Veterans Justice Programs at the U.S. Department of Veterans Affairs. Then we'll hear from teams in Middlesex County, Massachusetts, and in San Diego County, California, who will talk about the programming that they've set up in their jail facilities for veterans who are incarcerated, and the relationships they've built with their regional veterans justice partners to ensure successful reentry for veterans. And at the end of the webinar, we'll have some time for questions and answers. And I want to mention a few housekeeping items for this webinar. Anytime during the webinar, you can ask a question by typing it into the Q&A panel on the bottom right-hand portion of your screen. This includes both technical and content-related questions. We will try to reply to the technical questions as we go in the chat window. And for the content-related questions, we're running list and address them all at the end of the webinar. We'll do our best to get through as many questions as possible. If you encounter technical or audio problems during this webinar, please call WebEx Technical Support at 1-866-229-3239. And please understand that there are some technical issues that you may not be able to resolve. And for this reason, we are recording the webinar, and we will post it to our website at csgjusticecenter.org. We should have the webinar posted online by the beginning of next week. And now I will turn things over to Maria Fryer at the Bureau of Justice Assistance, who will introduce the Bureau of Justice Assistance to us.
Great. Thank you very much, Mark. Hello, everybody, and good afternoon. My name is Maria Fryer, and I'm a policy advisor for the Justice and Mental Health Collaboration Grant Program, or known as JMHCP, in the Policy Office at the Bureau of Justice Assistance. And I work at the Policy Office as a policy advisor at BJA to support states and local governments as they enhance and improve responses to people with mental illness, substance abuse, and intellectual or developmental disabilities. I oversee a number of programs and cooperative agreements pertaining to the between the justice system and people who have substance abuse or mental health and other developmental and cognitive disabilities. And the Justice and Mental Health Collaboration Program is one very well-known program within my portfolio. It's known as the JMHCP. And we're trying to achieve better outcomes with the JMHCP for people with mental illness and co-occurring substance addiction who are in the criminal justice. And the JMHCP strives to do many things, and it increases cross-system collaboration and supports comprehensive system-wide responses to reduce the prevalence of people with mental illnesses in jails, and improves access and connection to community-based behavioral health care as well, and to increase law enforcement strategies and also police mental health collaborations in the community, and generally improves system-wide responses at the state and local levels in policy and practice. And we work to provide the best possible guidance with a small staff, but we're very dedicated to translating best and promising practices into quality policies and programs for the criminal justice field. So I just want to welcome you and thank you for being on the webinar today. I'd like to thank all the panelists and CSG Justice Center for hosting, and I'd like you, thank you.
Great, thank you, Maria. Now I'm going to give some background on the Council of State Governments and the Justice Center. So the Council of State Governments is a national, nonprofit, nonpartisan organization that serves all three branches of state government. It is a region-based forum that promotes the exchange of ideas on a variety of topics to help state officials shape public policy. At the Justice Center, we focus on criminal justice, and we develop research-driven and consensus-based strategies to increase public safety and strengthen communities. We do our work by bringing people together, driving the criminal justice field forward with original research, building momentum for policy change, and providing expert assistance. And you may be familiar with some of our projects such as Face to Face, the Stepping Up Initiative, the National Reentry Resource Center, Clean Slate Clearinghouse, and the National Inventory of Collateral Consequences of Conviction. The Justice Center has more than 130 staff and offices across the country, including Austin, New York City, Seattle, and Washington, D.C. And joining us on the webinar today, we have a great list of panelists, and I'll introduce each of them briefly. We have Jessica Blue Howells, who serves as Deputy Director, Veterans Justice Programs in the U.S. Department of Veterans Affairs. In this role, Jessica supports field staff across the United States who provide outreach and services to veterans involved at any point in the criminal justice system. Jessica also oversees the VA's annual Challenge Needs Assessment, which engages input from veterans and homeless service providers across the country to help communities identify and plan to address unmet needs. Jessica has served as a co-investigator and operational partner on studies focused on homelessness and justice-involved veterans, and has published in areas of health services use among justice-involved veterans and needs of homeless veterans. We have Christine Brown Taylor, who is San Diego County Sheriff's Department's first ReEntry Services Manager. She oversees the ReEntry Services Division, which is responsible for the programming and operations in the 7 detention facilities in San Diego. Christine supervises over 150 staff and 1,000 volunteers who provide supportive services and interventions for over 5,500 people who are in custody. We have Sean Clark, who is National Director of the Veterans Justice Programs in the U.S. Department of Veterans Affairs. He joined the VA in 2007 as a Presidential Management Fellow and helped plan and implement the Veterans Justice Outreach Program, which has been providing outreach and linkage to VA services for justice-involved veterans since 2009. Sean holds a law degree from William & Mary School of Law, and he has also served as a Special Assistant U.S. Attorney in Washington, D.C. And Maria Fryer, who you heard from a little bit earlier, is a policy advisor for the U.S. Department of Justice, Bureau of Justice Assistance. She oversees the Justice and Behavioral Health portfolio and collaborates with the Council of State Governments Justice Center to assist states, local government, and behavioral health organizations to better understand the relationship between the criminal justice system and mental health populations, and to help create policy and programming that meets the needs of municipalities and the citizens they serve. Maria previously served in the North Carolina Governor's Crime and Commission and in community corrections in Fayetteville, North Carolina. She also served in the U.S. Army as a member of the Military Police Corps. And we also have Sheriff Peter J. Katusian, who is the 30th Sheriff of Middlesex County, Massachusetts. During his 8 years leading the Middlesex Sheriff's Office, he has launched multiple innovative, nationally recognized programs designed to address the needs of veterans, the needs of those in his custody, including the Housing Unit for Military Veterans and a medication-assisted treatment program named a Center of Excellence by the National Institute of Corrections. He is the current president of the Massachusetts Sheriff's Association and vice president of the Major County Sheriffs of America. And we also have Catherine Nicholas Mulvey, who is a licensed independent clinical social worker with the Department of Veterans Affairs and has been there since 2008. She is currently the Veterans Justice Program Coordinator for VA New England. Prior to this position, Catherine was a Veterans Justice Outreach Coordinator in Massachusetts for 5 years. She has extensive knowledge of veterans treatment courts and best practices for identifying and serving justice-involved veterans at every intercept point throughout the criminal justice system. And we also have Angela Simino, who is a licensed clinical social worker. She has a bachelor's degree in anthropology and a master's degree in social work. Ms. Simino has been with the Department of Veterans Affairs since 2010 and working with justice-involved veterans for the past 8 years. So a big welcome to all of our great panelists today. And now I will turn things over to Sean Clark and to Jessica Blue Howells to talk about the justice programs within the U.S. Department of Veterans Affairs.
Well, Mark, thank you very much for the introductions. This is Sean Clark. And just in the interest of time, I'm going to take us through the introduction to our programs. Jessica and I are both on and will both be available for questions at the end of the presentation. But just to keep it simple, I'll take us through our material here. And starting out, we're going to hear a couple of great examples of local partnerships where members of one of VA's 2 justice programs, Veterans Justice Outreach, play a significant role. And before we get there, I'm hoping to start by situating this program, VJO, and its companion program within the broader organization where we're based, the U.S. Department of Veterans Affairs. And so The first thing to note about VA is that we are a federal government agency, and that seems like a very basic point to make, but it's an important one because VA as shorthand gets used in a number of different ways, and that can be confusing sometimes. So I've heard VA used to refer to state departments of Veterans Affairs, also to other organizations, including some county veteran service offices. VA can be used in a broad way that can be, like I say, can be confusing. So when we're talking about VA and these two programs today, what we're talking about is the federal agency, the U.S. Department of Veterans Affairs. And what constitutes this agency? There are three main parts that make up the U.S. Department of Veterans Affairs, and they're listed here. First is the Veterans Health Administration, and this is a nationwide integrated healthcare system that VA operates for eligible veterans, and you see the number of facilities that we have across the country listed there. The second main component is the Veterans Benefits Administration, which, as the name suggests, administers benefits, primarily financial and educational benefits, for eligible veterans. Some of the best known of these are the GI Bill and all the different variations that that's taken over the years, but also several others that you see listed here. Vocational rehabilitation, for example, disability compensation for veterans who are injured in the course of their service as well. Last but not least is the National Cemetery Administration. That's the third leg of the VA stool. And NCA honors veteran service by operating over 100 national cemeteries across the country and by providing funding and significant support to state veterans cemeteries across the country. Also individual burial benefits for veterans who are laid to rest outside the national and state cemetery systems, and some of those are listed there on the screen. So those are the three main components of VA, and I'm going to focus on the Veterans Health Administration because that's where we're based in the Veterans Justice Programs. VA defines healthcare in a very broad way. So the homeless programs in the Department of Veterans Affairs are a part of our healthcare system. Veterans Justice Programs are part of VA's effort to prevent and end homelessness among veterans because of the close relationship between incarceration and homelessness. Incarceration as an adult male, which is the majority of the veteran population still, although that's changing. Incarceration as an adult male is the most powerful predictor of homelessness that's been demonstrated. And so that's why our work with veterans who are justice involved takes place in the context of the homeless programs in VA. On this slide, I want to talk about what defines our work in the Veterans Justice Programs. And I will not read to you our entire mission and vision because that's there for you on the screen. You can see what those are. I just want to pull out a few key points that really encapsulate our work and what it's about. First is outreach. So these two programs that I'm going to be talking about in a little bit more detail here shortly are intended to contact veterans in criminal justice settings through outreach. These are not medical center or facility-based programs. The point is to project the capacity of our healthcare system out into the world and specifically out into criminal justice settings, prisons, jails, courthouses, and to find veterans who need help accessing VA services and to help them do that. That's the second key point I wanted to pull out here is this notion of facilitating access. That really is where this all begins and ends for us. Outreach is never done for its own sake. The purpose of going out and identifying veterans and helping them get to the services that they need, that really is the core of the work, is ensuring that when veterans have unmet needs for treatment services, for other services that VA can help them with and that they're eligible for, that's the linkage that we want to see made for that population of veterans that may face barriers that veterans who aren't involved in the justice system would not. The last concept that I want to pull out here under the mission is the notion of partnerships. And you see that Our mission is to do all of these things by building and maintaining partnerships between VA and criminal justice partners. And in a way, that's one of the most important concepts on this whole slide, because none of the work that we do in the Veterans Justice Programs is work that we can do on our own. We have no right of access to any criminal justice setting across the country, to a prison, a jail, to a judge's chambers. Our ability to do our work is entirely dependent on our field staff's ability to build and maintain partnerships with prison wardens, with local sheriff's departments, with judges and other practitioners in the criminal justice system. And so that's something that I try and note every time I talk about these programs, is that we can't do any of this entirely under our own steam. To the extent that we're successful in this work, it's because of these partnerships that enable us to do it. And if we could move on to the next slide, please. I won't dwell here long. This is a busy slide. I apologize for that, but it is a useful slide if you want to spend some time with it after the webinar. It is a simplified rendering of the criminal justice system based on the sequential intercept model that's been out for a number of years, and it's used as a tool to plan interventions to deliver treatment services in criminal justice settings. The reason we include this is just to show you graphically where these two VA programs sit in the course of someone's progress through the criminal justice system. And really broadly speaking, again, without reading any of this out to you, the VJO program, Veterans Justice Outreach, is focused on the early intercepts here on the model. So interfacing with law enforcement, with local jails, and with court systems. The Healthcare for Reentry Veterans, or HCRV program, which I'll also talk about, is based at the back end, so to speak, of the criminal justice system, and working with veterans who are in the reentry stage, coming out of incarceration in state and federal prison. And this just shows that in a visual way, and lists those programs alongside other resources that are operating in those same settings. So we can move on to the next slide. Pausing for a moment and talking about the VJO program, which is the one that we'll hear the most about this afternoon. This is an outreach program. We have a presence for VJO at every VA medical center across the country. Every one of our medical centers is required to have at least one VJO specialist on staff. Most of them now have more than one. And their purpose, as I just mentioned, is to be the liaison between the VA healthcare system and the criminal justice system in the communities that they're serving. And specifically, that means working with local law enforcement and working with staff in local jails and local courts. The point of all of it, of all of those partnerships, again, is to facilitate linkage to services for justice-involved veterans at the earliest possible point. When veterans are held in a local jail, the earliest possible point is after they're released. VA is unable to provide treatment services for veterans while they're incarcerated. But once a veteran is released, his or her eligibility for VA health care is restored once the veteran leaves that facility. So the work that we do in correctional settings is significantly focused on helping a veteran plan to access services that are going to meet his or her needs once the veteran is out of that facility. It's forward-looking because we're not able to go in and deliver clinical services to the veterans while they're in that setting. This program is growing. We're adding 50 new VJO specialists this year in response to some congressional legislation, which we greatly appreciate that support. We're funding over 360 VJO specialists across the country, and the program is best known for its work in veterans treatment courts, which are another rapidly growing model and have gotten a lot of attention as they've grown over the course of the past 10 years. VTCs are, like I say, what we're known for, but they're far from all we do. And VJO specialists see more veterans outside veterans treatment courts, for example, in local jails, than they do in them. And we can move to the next slide, please. Healthcare for Reentry Veterans, the other program that I mentioned, and the second of the two that comprise VJP, is focused on veterans who are preparing to release from state and federal prisons. And the point of this work is the same. It really is focused on helping veterans identify their needs and working to access responsive services once they get out. But the needs that those veterans may encounter are different because their experience may be significantly different. Where a veteran may have been sitting in a local jail for 60 days, by the time a VJO specialist meets with him or her, in the HCRV context, specialists are working with veterans who may have been inside for 10, 15 years or longer. The degree to which their social supports have eroded over the course of that time may be much greater. They may be walking out into a very different world than the one they left. And so they may require more extensive services, more supports when they come out. But again, in broad outline, the point of all of this work is the same, which is to help these veterans identify the services that they're going to need and access them as efficiently as possible once they get out. That is the bird's eye view of the Veterans Justice Programs and the two programs that comprise it. And if we could go to the final slide here, I'll leave you with this, which is contact information for myself and my colleague Jessica here in the program office, but also for the local staff across the country. These are the program websites for VJO and HCRV. Both of them allow you to contact directly the field staff who work in the area closest to you. You're able to send them an email from the website. So I'll commend that to you as a useful resource if you're not familiar with who's serving your area for these programs. And with that, I'll thank you for your time and the ability to talk to you about VJP and hand the mic back over to Mark.
Great. Thank you so much, Sean, for that overview of the Veterans Justice Programs. So now I'm going to turn things over to Sheriff Peter Katusian from Middlesex, Massachusetts, to talk about the Veterans Programming at his facility, and to Catherine Nicholas Mulvey from the Veterans Affairs in New England to discuss collaboration and service coordination.
Thank you very much, Mark. And Sean, thank you for that great presentation. I'd also like to thank CSG and the Justice Center for hosting this webinar. This is an area that we're not doing enough. It's not that difficult to do, and the results are quite remarkable, so it's a win-win-win, and more of us should be doing this. I came to this area when I became sheriff, and one of the first things I was inquiring about was how many incarcerated military veterans do we have in our facility. And the reason I was inquiring was because my grandparents fled the Armenian genocide coming to this country, seeking refuge and finding opportunity, but 3 of their sons served in the military, one who passed while serving in the Philippines. My Armenian grandmother was just a woman that couldn't even speak English fully, yet she, for all intents and purposes, was a Gold Star mother. One of my uncles became a veteran service officer, and because of this experience and my exposure with my Uncle Jack, I was very aware of the issues regarding veterans and wanted to do something for them. Before we get to our presentation, I wanted to share this quote from Bill. Bill is a 70-year-old Vietnam veteran serving his first period of incarceration with us. I think his quote, sorry, that should be on the next slide. You can see from his quote, it's quite powerful. This was provided for a research project we're working on. It encapsulates a lot of what we are trying to accomplish with this unit, to allow veterans to use their camaraderie to their advantage, to break down barriers, to allow them to support one another, and to allow them to open up themselves for the purposes of receiving the treatment that they, in most cases, really need. And one of the interesting things about Bill's story is how he ended up with us. It wasn't his crime, but that his offense was committed in another county, and that he requested the judge sentence him to our facility after he heard about it from former Humvee Housing Unit for Military Veterans unit participants who were now participating in a program at the local VA. What's really important is that it should be understood that this is not just a housing unit for veterans. This is a therapeutic treatment housing unit for veterans. And please understand that housing units are not, they're better than nothing, but they're not what we should be doing. Next slide, please. The goal of Humvee is to create a space within our facility where veterans can call upon their common bonds to address the issues that led to their incarceration. It's a lot more effective than even I thought it might be. For some, it might be directly correlated to their service, and for others, it might be related to issues that arose after their service. Quite honestly, for many, they had issues before they served And I really don't care when those issues arose, because for us here at Middlesex, all that matters is that he raised a hand and swore an oath. Doesn't matter if you served in combat, whether you were on a cutter based in the Coast Guard sector in Boston, or you were a National Guardsman who never deployed outside the Commonwealth. Here, your discharge status is not a barrier to participating in this unit. In fact, where possible, we have been working with Harvard Law to see if we can get discharges upgraded. This is about trying to create a structure and a support that helps folks right the ship that has been going wrong for them before they got here. Next slide, please. Now, from the treatment behind the walls to the ability to have cases diverted to the Veterans Treatment Court to the continuity of care in the community, all of this has led to incredible, and I really mean incredible, early successes in this unit. As of our most recent data poll, we had 100 men that have spent at least 30 days in our unit and that were released into the community. We use this threshold because the unit is mixed. We actually mix our pretrial and sentenced folks in here. This is something also that's pretty unique about our program, because all too often in correctional settings, pretrial detainees just don't get any programming, and here we're trying to offer it to a population that we believe can use it. It's possible that some of those pretrial folks could post bail or have their bail lowered and be released, so we use a 30-day baseline as the basic metric. Of those 158 men, 83% have not recidivated. Now, that, by the way, it's not just a one-year number. That's rolling over 3 years now. So 17% have not, 17% recidivism rate. When you compare this to our general numbers, 1 year is 28%, but our 3-year recidivism rate here ranges in the area of 47 to 50%. So significant, like 3 times lower recidivism rate out of this unit, and we believe it's because of the therapeutic nature of this. Also, our parole granting rates are extremely high. We've had a number of revised and revokes, meaning where they've actually gone to change the sentence to lower the sentence. Because of the work we've done, we've been able to address their discharge and hopefully upgrade them. Many have been able to actually, instead of going upstate to a state facility, have actually remained in our facility. And some actually, quite honestly, have stayed in our facility for a number of weeks, a month and a half, longer than they needed to. They were free to go to a parole bed, but they decided to stay in this unit in order to stay here with the therapeutic community and then go to an appropriate veteran-specific PTSD parole bed. So actually staying in jail for more than a month necessary than they needed to. Next slide, please. So how did we get here? How did Humvee come to be? In 2012, we began conversations with the Veterans Affairs about ways to create better pathways for reentry. First hurdle was actually knowing who in our custody was a veteran, which was quite frustrating. We now moved to mid-2013, and we became one of the first agencies that is in the country to sign on to the Veterans Reentry Search System. This is something that Katie will explain in a moment, but this is crucial to what we should all be doing. This is a system that allowed us to match the names of those in our custody against the names of military service members. All anyone was doing before this point was just having self-reported, and we knew there were a lot of people that weren't self-reporting. In fact, the first time we ran this, we had 19 veterans in our custody that had self-reported. Indeed, after VRSS, we found we had another 44, having a total of 63. Now that we could actually create a more critical mass and get more programming to, but again, 2/3 more that we had that had self-reported. And I'll say, whether you have a veterans unit or not, I believe every correctional facility should be using VRSS to identify veterans in our custody, because not knowing how many veterans in our custody is part of the problem, so everyone should be doing this whether they have a program. That was really our launching point. As we moved to 2015, and we're talking internally about the creation of a new unit for veterans, when a group of veterans themselves actually self-advocated and approached some staff members with the very same idea. So it's really pretty, I just love the fact that it came from both staff and these veterans as well. In 2016, in January, the first inmates moved into Humvee, named by the inmates themselves. 2 months later, Governor Baker joined us to formally open the unit, and he participated in a nearly 30-minute long closed-door roundtable with veterans. Since then, we've hosted visits from our Secretary of Veteran Services, Francisco Urena, General Bissaker, Commanding General of the U.S. Army Corrections Command, corrections professionals from all around the country, Texas, Arizona, General Hammond from home base here, and it's been an incredible opportunity to show what we're doing and to show that it can be done for many leaders in our community. Next slide, please. One of the first things that is really important for us as far as Humvee goes is that it's a voluntary program. Not all veterans have to participate, nor do they want to participate. And if you're going to be in Humvee, you're expected to participate in the treatment and the therapeutic programs. We identify individuals who want to participate in Humvee a couple of different ways. First is through the self-identification at or shortly after intake. The second is through the VRSS, where we send names off and they come back, and then our program director will go speak to those individuals. And really importantly, the third, because we're the only unit in the state, and there's really not one around, anywhere around, the third is through transfers from other jurisdictions. We've had countless individuals transfer in from other jurisdictions across eastern Massachusetts. Next slide, please. Our unit is not the first, and nor is the last created for incarcerated veterans. In fact, the San Diego unit you'll hear about today opened years before us, but 3 years after we opened, we still remain the only dedicated unit in Massachusetts. I'm not sure that even another one has opened up in all of New England since we've opened ours as well. We think we found a great formula that's working for the veterans in our country, those who transfer from other courts across eastern Mass. We understand our jail cannot be a fortress on a hill. It's part of a community. Almost 100% of these men in our custody will return to the community. We need that community to be supportive, so the public has to know and feel engaged with this as well. With Humvee, we found overwhelming community support from government agencies like the VA and the Mass Department of Veteran Services and the Mass Trial Court, nonprofits like Home Base, which is a partnership between Mass General Hospital and Boston Red Sox, tailored a modified version of their Resilient Warrior program for this unit, and specialized training like employees at McLean's Hospital that come in on Friday afternoon, not as employees of the hospitals, but as volunteers on their own time to facilitate a spirituality and mental health group. Thanks to the efforts of these partners and many more, Humvee is truly a therapeutic community. Now I'll speak about the programs briefly before I turn it over to Katie. And those who offer services behind the walls are not all that there are countless others who are providing post-release services. It's that continuity of care that is making a lasting difference for most of these men, for many of these men. One thing we recognize with Humvee is that the underlying factors that lead veterans to our custody are not all the same. Though two primary contributors are most likely the same in most of these folks, it's substance use disorder and mental health, so we try to offer a broad range of programs specifically tailored, some of which you will see on the screen right now. Seeking Safety is a program facilitated by a licensed independent clinical social worker from the Lowell Veterans Center. It's an evidence-based treatment that addresses co-occurring symptoms of PTSD and substance use. We use the Resilient Warrior program from Home Base, that's that Mass General Red Sox program, designed to help veterans manage their stress more effectively, and I'm proud to say we've formalized an agreement to have this continue running in our facility. Battle Mind, facilitated by Donald Jarvis from the Commonwealth Statewide Advocacy for Veterans Empowerment, or the SAVE program, has been modified to encourage open discussion about what influence and impact a military veteran orientation could have on the lives of incarcerated veterans. Who's not on the list and I don't believe can be discounted are two factors. First, the of our program director and the uniformed officers who work in Humvee on a daily basis. Some are veterans and some are not, but they all have embraced the effort and what we can make it today. And the second are the veterans themselves and the way they look out for each other and take care of each other. My last slide before it speaks to Katie, I mentioned community support and partners. I really believe this program would not exist in the fashion it does today without the support of our partners. That especially goes and Katie Nicholas Malvey. We are truly lucky to have such a great relationship with our local VA officials, but it's also one we're constantly working on and tending to. Katie and Program Director Naomi Doty, who is our director here at the Middlesex Sheriff's Office, who's herself a Navy veteran, hold nearly weekly meetings. Their open lines of communication are critical in carrying out and developing initiatives, but also in making sure that any issues which may arise impacting those in our custody are addressed as quickly as possible. Now I'd like to turn it over to Katie to speak a little bit about the VA's efforts with our program, the Humvee program here at the Middlesex Sheriff's Office.
Thank you, Sheriff. So I'm going to cover our relationship with the Middlesex Sheriff's Office and the Humvee unit. We'll talk about both the reentry services that are provided as well as the justice programs and the pretrial side of the house. We'll also cover some of other initiatives that we're doing in the state of Massachusetts in terms of diversion, data collection, and the use of VRSS, as the sheriff did mention as well. But I think what you're going to hear repeatedly, Sean mentioned it, as did the sheriff, is this notion of partnership and how we need to be on board together to further overall improve the justice system. So first off, hold on, we're going to go back to, can we go back a slide, please? Thank you. So for our healthcare for reentry, this is a clinician who goes into Humvee. She goes in weekly, if not more, to provide services. And services include running a group. Right now she runs a wellness recovery action plan group to help them get ready for discharge and release back into the community. This is an ongoing weekly group. We're currently in the midst of trying to get her trained in MRT, motor recognition therapy, that's short-term, more specifically designed for a correctional facility like a Humvee unit to help, again, improve their chances once they get released. With her going in weekly, it gives that connection to veterans. So although the mission is that we need to see these folks within 6 months of discharge, we're seeing these folks well beyond that 6-month mark. We're able to go in and see them when they get sentenced, if they've been held pretrial and then they get sentenced. So it gives us the opportunity to build rapport with them pretty quickly and for an extended period of time, which then lends itself to better understanding their needs in order to help them establish a discharge plan. And with that, it helps us with the parole efforts. So with Humvee specifically, we're able to write very specific, concrete parole letters with a plan in place, with programming specified. Instead of hearing from parole and parole telling us what we need, we can send it up to them and see if they'll accept it based on what's clinically indicated. So we've had great success with that because of how connected we are to these folks immediately when they get there. And then with the use of the VRSS, which is, again, Veterans Reentry Search Service, we're able to identify every single veteran in their facility, and then we run them for VA eligibility. And when we do that, we're able to more efficiently put together a treatment plan. Lastly here, we run a post-release support group that's on campus. It takes all of those folks from the Humvee unit. A lot of those folks come back to the VA on the outside. It's run weekly, but it also includes folks from other who are Reentry Society from other facilities. So they could be released from the Department of Corrections facilities or other county facilities. But it also includes folks who are criminal justice involved who might be at a different intercept point. So folks who might be in a Veterans Treatment Court or those folks who are on probation. So it brings together all of these veterans. It helps talk about some of the barriers they're experiencing and the challenges. They have each other's support. It's non-judgmental. And then they help troubleshoot some of the problems of transitioning back, what they're experiencing, how to get a job, the fact that they might need a haircut and they can't seem to squeeze one in before the interview. And so, well, somebody learned how to be a barber while they were serving time, and they can give that guy a haircut. So they've really been able to connect with each other and to be a positive peer influence on the outside. Next slide, please. On the pretrial side, so those folks who are held who have not been sentenced yet, they work with our Veterans Justice Outreach staff. Those two are social workers who are independently licensed. And with the use of the Veterans Reentry Search Service, Middlesex specifically is running it twice a month. And so that allows us to catch those folks who are held pretrial, who might be held with bail. And if that's the case, they might post bail and get out soon. So that's why we run it twice, to try to catch those folks before they get released. It certainly helps us catch them if that was the only point that we may have actually been able to identify them. So it expands our efforts and efficiency and absolutely being able to effectively more meet their treatment needs. The Veterans Justice Outreach person goes in, they complete assessments, and they determine treatment plans. And with those treatment plans, we're able to go to court with them, advocate for them, and help propose an alternative to sentencing if it's possible, if the court's willing to consider it. but it also helps to inform the overall disposition of the case. So we found that to be incredibly helpful at this point. It helps enhance access to a veteran's treatment court, whether it's through the Veterans Justice Outreach Coordinator who informs them that this exists and that they can communicate with their attorneys, or if it's from other peers who are sitting with them in the Humvee unit. So they can hear it from us, but they can also hear it directly from their peers who may have already been in one, who are being held on a probation detainer. And of course, a peer's word probably goes far beyond what we can offer them, but it's nice to be able to troubleshoot some of those concerns if they have any. And then the other piece too for us is when we engage with them, we can explain to them if they're not in that Humvee unit, they might be in general population, or they could be in another facility. And we would explain to them that Humvee exists, how it can be beneficial because of all the treatment that's being offered there, and how that can be viewed favorably at the time of disposition. So folks who, we've had a few folks who are in other facilities, and we go in and say, hey, I think you really could benefit from being transferred to Middlesex Sheriff's Office into their Humvee unit because of the treatment offered. And the court looks at that as they are motivated for change. And so if they're willing to sit there and go through treatment for months before their disposition comes up, that is viewed favorably and they get a better disposition, or at least it's possible to get a better disposition as a result of that. And then, again, we can help facilitate. So if we're identifying veterans from other facilities, we would call up the program manager at Humvee and discuss with them the possibility of a transfer, and then they can go and do their interview with them and try to facilitate that. Next slide. The other relationship that we all have with the Humvee unit is with the veteran treatment courts. So both, or I should say all of our veteran treatment courts have a relationship with the Humvee unit. All of them have a Veterans Justice Outreach clinical social worker in there. And so it's been agreed upon that they will take directly from a court session if they're being held in a probation detainer, sight unseen, essentially. So the program manager doesn't necessarily have to go and interview them. They would trust our judgment that they would be an appropriate fit and they can benefit from being on the unit. So that's been a huge advantage for us. It gives them access to treatment while just sitting. So you're maximizing their time. You're maximizing the detention. The one drawback, I would say, is that we don't ever want it to be easy to detain somebody or to sentence somebody, but sometimes it looks really favorable to send somebody there because of all of the services that are offered in that confined space. The other piece, too, is that it offers a positive influence with all of their peers. So if somebody goes in, we know that they're going to be surrounded by peers who are in a similar boat, and they're in different stages. Some folks have been there for a year. Some folks have been there for 4 months. And wherever they are, they can give a different perspective if somebody is down in the dumps or not looking at things as bright as they could because they were just held. So we've seen a lot of positive peer interaction from this relationship with our folks in the treatment court. And then lastly, what's really a huge advantage is that the program manager is a social worker. It's a bonus we all value, but she also sits in their county's treatment court. And as a result, she's got all this extra information that she can share with that team that's invaluable because we don't get access to that sort of information where she has access to their day-to-day behaviors and engagement as well as the feedback coming from the correctional officers. And so she can bring that back to the team and say, this is what she's seen versus what we see in court for a very limited amount of time, or when they're sitting with their case manager or clinician in a VA, and again, a very limited amount of time, they're getting them every single day, all day long. So it gives you a far more robust clinical picture. Next slide, please. Outside of the Humvee unit, another piece of services for veterans in the criminal justice system en masse is the BRAVE Act. It's essentially a diversion bill specifically for first-time offenders with no previous convictions and no history of diversion. It's for operating under the influence charges, first offense only, and they have to have been diagnosed with a substance abuse, mental health, or traumatic brain injury diagnosis. in addition to having a nexus that relates back to their military service. If that all happens to be true, they are eligible to get their case diverted prior to arraignment, so it never appears on their criminal record. The other piece that this act did, so the way we view it is, on the continuum, these are those folks who are generally lower risk, lower need, that you can potentially divert. But it catches them a bit earlier, so it then puts added pressure on our probation department, which is a very early intercept point for Massachusetts. Every defendant who goes into the court system has to meet with a probation officer to determine if they are eligible for defense counsel financially. And with that, on that sheet, it asks, have you ever served the United States military? If that is a yes, it's a referral that comes directly to the Department of Veteran Affairs, and we're able to collect a significant amount of data on that. So we provide them a point of contact to help connect them to services, to do clinical assessments, to the to the State Department of Veteran Services for peer support. But then we also have a robust amount of data as a result of that that we then share with our Massachusetts trial court and the legislature to highlight what we're looking at in terms of typical offenses, profile and needs of the justice-involved veteran population. That also becomes really relevant to the services that VA can provide. So, for instance, what we're seeing is assault and batteries is the number 2 referring offense in the state of Massachusetts. And within that very large category, domestic violence takes the top referring offense. So we've really pushed the use of intimate partner violence treatment within VA to get this more widely spread and accessible for veterans because it's clearly a need, and the question becomes, how do we better serve this population? And then the other piece, and I'd say it's one of the most crucial pieces to the work that we do, is the Veterans Reentry Search Service. So we've referenced this a few times. It's a database designed to merge with any other database in the criminal justice system, whether it's a correctional facility or defendants with open cases sitting in a trial court or folks on community supervision with probation or parole. So we're able to merge this database with any other database to pull out all those veterans that are at that intercept point. Right now we have every correctional facility in the state of Massachusetts using it, to include all of the county facilities and the Department of Corrections. And so because we have this, it allows us to be far more efficient in how we do our job. It helps us to prioritize based on release dates, based on next court dates, who we see and when we see them. So for us, we can do our job more expediently. We can also see more people because we can better use our time wisely. We're not wasting time going to a facility where it's only 1 or 2 people versus going to a facility that has 67 people sitting there. So how do we better use our time to serve more people? And this program really allows for that. You can use it, again, at pretty much any intercept point that exists with a database. So right now we're working with our probation department in Massachusetts to get all of those folks who are sitting pre-trial with conditions of release, as well as all of those folks who are on standard probation. And then, as we've already indicated, we have all of the correctional facilities using this. And then lastly, this helps us with transfers. So whether a person is in another correctional facility, it doesn't matter where. The Middlesex Sheriff's Office has been very willing to accept folks across the state to go to their Humvee unit to be able to access the treatment that they offer. Next slide. So one of the things that Veterans Reentry Search Service does well is it's very informative for us of how we do our outreach. So it can highlight for us who we need to target so that we can better partner with people. So for instance, we run the Veterans Reentry Search Service, and for the first time, 64 people hit on a facility just recently. It was a facility that prior to that, they didn't identify veterans. So we went from 0 to 64. And what we were able to identify is that most people there were held pre-sentenced. And so that helps us, determine, well, we need to do some education up there. How can we better partner with the DA's office? How can we better partner with the judiciary to let them know the VA has some services that they might find helpful, that they can consider as an alternative to detention? So those are some of the things that we're doing and trying to work with to better educate folks, and then to also better partner with them, let them know what we can do, what we can't do, signing of releases of information so that we can be as transparent as we can to maintain our credibility. And then it also allows us to be helpful in terms of creative dispositions. So there are folks who are 100% service connected, and we get calls when we know they're going to be sentenced. And some prosecutors don't want to hammer them. I mean, they have to sentence them. They're planning to do it. But if they're 100% service connected and they have 2 kids at home and they're up on a sentence on a felony, they're going to lose those benefits. They're going to drop to 10%. So one of the things that we've tried to do is to help them say, well, alternatively, can you hold them up front instead of all on the back end and give them time served by the time the sentence comes down? So trying to get a little bit more creative about how they sentence, if it's going to be to try to maintain some stability for their families while they're serving some time. And then it also helps us enhance the work that we do. So how, when we have VRSS, we can see more people at one time. One of the things we're doing right now is when we find out that there's 65 folks sitting in a facility and they don't have a veterans pod, well, can we have that conversation? What else can we do to better serve them? If it can't be a veterans pod, can we have certain days where we build, a program around it, Monday, Wednesday, Friday, of community providers coming in, whether it's VA and the Department of Veterans Services for the state, or a vet center system, or VBA. So we've been really trying to push these other avenues. In the event the pod doesn't fly, can we do something as an alternative to better serve and more robustly serve this population while they're sitting there? And then for us, as the sheriff indicated, this is a community support. We are in this together. And so we've been able and very fortunate that we have a lot of community support in this particular area. The state has both on the western side of the state as well as the eastern side, a lot of resources that are willing to go in and support this particular population, whether it's on the front end or the back end when they're sentenced. So we know we're fortunate. It's a resource-rich state, but we really try to maximize all of that support. And then lastly here is that use of telehealth in order to help us expand access. So one of the things, although there might be some facilities that might take us an hour to get to, sometimes it's just because of traffic, and we have a lot of that going on here. But having that telehealth in place allows us to do a lot of case management. Again, it enhances efficiency because we don't have to get in a car and waste an hour. We can do all of it from our office or from the car when we're driving or wherever it might be. But it also allows peers to connect with veterans before they get released, to do that face-to-face to help ease some of that anxiety that they're facing as they're approaching release. So for us, all of this has been huge and crucial to how we better access the veterans and also how we better serve them. Thanks.
So thank you, Katie, and I'll just wrap up with one last slide here. If you want to go to the next slide, please, Mark. Just considerations for starting a veterans unit, just for people that are considering this. I think it's really important from our successes and our failures. Starting a dedicated housing unit requires some long-range and some short-range strategic plan. It's not rocket science, so people can do it. There are just a few things I'd encourage anyone considering opening a unit to consider. Number one, determine if enough veterans exist within the geographic area of the facility and within the facility itself to support the program, because if you don't have enough folks in there, the program will not work. Now, you can get this from data from the U.S. Census, and the VA and VRSS can also be helpful with this regard. Two, partner with Veterans Affairs agencies from all levels of government, federal, state, local, nonprofits. Multi-agency collaboration streamlines service delivery, arranging complementary services for veterans and preventing duplication of efforts. And by the way, they all want to help. They all want to participate. But you also have to remember that individualized assessments, case management, and access to entitlements Agencies offer an array of services and therefore should play an integral role in the program. You should conduct an inventory of potential community partners and seek buy-in from key stakeholders. Lining up community support from nonprofit organizations that work with veterans will help to inform the development of the programs that you include and involve, and validate the need as well. You should consider forming collaborations which will bring expertise and specialized services to the program, and really importantly, integrate existing community-based frameworks into the unit's programmatic structure while offering cost-free resource. I'm going to just say two last things. This is not a case of build it and they will come. I know that there have been other units that have built the unit and the services did not come. They were not prepared. They didn't have any reentry prep. They didn't have the services because they just thought they didn't really think it through enough to build those relationships before they created the unit. I will say that if you're worried about money, this unit does not cost almost anything more than a regular unit for us. Quite honestly, it's not much money. So much of the work that we're doing is free, voluntary, collaborative work that is sustained at a very high level and over a long period of time. So there's a lot of people that want to participate in units like this. So it's a lot of passionate support for these types of things. And then I would just say, this is something really important to do. I would ask that if you do this, don't just consider a housing unit, but a therapeutic unit. It is the right thing for veterans. It's the right thing for the communities. And quite honestly, the public loves seeing units like this. They care about units like this because they care about their veterans. And units like these make people understand and care about corrections as well as the veterans themselves, and restore faith in what we're doing with those in our care, custody, and control. Thank you very much.
Great. Thanks so much, Sheriff Katujian and Katie, for your presentations. So now I will turn things over to our friends on the West Coast, Christine Brown-Taylor at the San Diego County Sheriff's Department, and Angela Semino at the Department of Veterans Affairs.
Good afternoon, everybody. It's always a little hard to follow the sheriff. So we've been in several meetings, and we like to compare notes on what our different units look like. So let me give you a little bit of background about San Diego County. We have a large jail system. We have about 5,700 inmates in our custody at any given time. We're a large geographic area, very different from the East Coast. Our county, from the furthest south jail, which is down by the border, all the way up to the north part of the county, will take you an hour drive in good traffic. So we're very well spread out, which means the veterans in our community in San Diego are very well spread out. So if you're not familiar with San Diego, we have a lot of military bases. We have a lot of Navy. We have a major Navy base. And then we also have Camp Pendleton, which is all the way at the north of the county. And Miramar. So there's a lot of military folks that live in San Diego, whether it's family members or veterans themselves or active duty military at any given time. So there's a lot of support for our veterans in our county. There's a lot of smaller nonprofit agencies. There's a lot of government support, and I'll talk a little bit about that later in the presentation, as well as a lot of interest in what is happening with our military folks at any given time. So our county government has decided that they really wanted to put a lot of focus in what was happening with veterans across the county, and we have developed wellness centers that have county staff that are also working to support the veterans in our community. So our program, we started in November of 2013. We knew that we had a lot of veterans in our system. We didn't know the number when we first looked at it. And we actually went and looked at several other sites that were developing their veterans mod. One of the first ones in the country was in San Francisco, and we went up there and we visited and toured and got an understanding of what their veterans unit looked like, and then we decided that we were going to do one-up them and do something better. So there's a little bit of a competitive nature in the fact of, we want to make sure that our unit is operating better than everybody else's. So the first thing that we started doing, and we have been doing this for a while, is when someone was booked into our jails, we'd ask them if they were in the military. It was just a very simple question. The nurses actually were the ones that were asking them, and we were able to capture and look at the numbers and say, okay, how many people actually are saying that they're in the military? Now, if you know anything about data and having the ability to kind of track anything, you know that that's probably not a good system in place, but that was our starting point. So we knew that we had the population, and that was what the sheriff was alluding to, is that, when you have jails, you need to make sure that you can house a number of people in those specific housing units. So we had to guarantee to our command staff that, yes, we could fill the unit. This would be able to, have the ability to provide specific programming to these vets. So what we wanted to do was look at what our purpose was, and it was to create a safe environment, create a community, and the sheriff spoke about this a little bit, but, and a lot of the veterans in our program had said, this is the first place and they feel like they can heal themselves. There's a lot of trauma that's associated to the veterans that are in the unit. There's a lot of people that have experienced military trauma as well as just life trauma. A lot of them have undiagnosed PTSD, and there's a variety of ages from people that have been 18 years old all the way up to 72, I think was our oldest person that was in our veterans module. So we wanted to be able to be very comprehensive when we designed the program. We did it fairly quickly, and we wanted to find out, first of all, which deputies would be interested in working in that unit. And we were really pleasantly surprised that when we, the captain at the time that helped to create the unit, she had put an email out to all of her sworn deputies in that particular jail and said, who's interested in working in this unit? And we had an overwhelming response, said, yes, I'm really interested in working with veterans. And the vast majority were veterans themselves. So what we did is we made a selection of the specific deputies. We put together our policies and procedures. We talked about incentives and sanctions for the unit, and then we did some specific training for the deputies. And that was with the assistance of the VJO. They created a PowerPoint slide. We came in. We provided training about roughly about what trauma was, what PTS was, what are the symptoms, the signs, what the VA can provide services for, what the transition would look like. And I think that that's really important because you have to get the buy-in from the deputies or your correctional officers if you're going to be instituting the program. We also then what we did is we kind of put out a call to all the nonprofits in the area in North County, and we said if you're interested in working with us in developing this housing unit as well as providing services, whether it's inside or outside, we would like you to attend a meeting. And we did that, and we actually had a really good response, a lot of questions about what this was going to look like. And initially we didn't have all the answers, but we wanted them to feel like they were strong partners in our development of the program. And then we launched it and opened it. So we can go to the next slide. Sorry, I should have been advancing the slides. I talked about this. I do want to say, just go back one slide, please. I did want to say that you'll see that some of the pictures in here, a lot of the artwork was painted by one of our deputies that provided security in the housing unit, as well as feedback from the veterans on which pictures for him to paint. Okay, you can go to the next slide. So this is just kind of an overview overall. What we have found is that generally at any given time we have about 300 veterans in custody. And if you're familiar with how jails work, some people could be in custody for a day, some people could be in custody for years in the state of California. So Initially, the number was not nearly that high because we couldn't capture it all, but we have been using the VRSS, and I'm going to talk about that in a little bit. So we opened it up initially with just one veterans module, but then about a year later, we knew that we could house 2 modules. So right now, we have 2 operating modules, and they will hold up to 64 veterans. So there is some criteria to get in there. It is all voluntary. And we also have a lot of people request to go into the unit, but we would say that they were we have a classification system of who's eligible to go into what housing unit. These are more lower level classification. Doesn't mean that they haven't had some significant criminal history, but they're appropriate to be housed together and to be able to be participating in classes. We do look at it case by case if somebody has some significant mental health issues. Some people can function in that environment and some cannot. We will try. We'll get feedback from our doctors and nurses and mental health staff to say, I think this person would be able to function in this housing unit. And we've had some successes, and we've had some folks that it just doesn't, they just can't function very well in there. We accept all branches and types of discharges. We have a lot of classes. It's a lot of programming, what we would say, is Monday through Friday from about 7:30 to about 3:30 in the afternoon. There's a lot of activities. And we have a lot of CBT, cognitive behavioral interventions and classes that we are providing for the vets. And our main one is Thinking for a Change, which is developed for the criminal justice population by the National Institute of Corrections. And that is free curriculum if people are interested in looking at it. We also do things like yoga, meditation. We have college classes. We partnered with a community college that is located in North County. They've been very active in providing college classes, and we're looking at possibly enhancing and doing even more work with the community colleges. 2 other things that we do is we make sure that the vets have an ID when they get released. We have a MOU, a Memorandum of Understanding, with the Department of Motor Vehicles in California, and we've been able to get their California ID prior to release. We also, if they're not eligible for veterans medical services, then we will enroll them in Medi-Cal prior to the release. One of the other things that we have is we have a dedicated correctional counselor that works in these units and provides some programming, but mostly does all the organization of who's coming in, going out. They work very closely with the VJO, and they have either been in the military themselves or have family that had been in the military. So I think that that's really important because then they work very closely with the deputies, the professional staff, the VJO, and all of the nonprofit agencies that are coming into the facility. You can go to the next slide. So some of our community partners, we wanted to make sure our criminal justice partners were on board with this. So we had convened, and we still to this day will have multidisciplinary team approach. We work with staff from the district attorney's office, the public defenders, Superior Court. That includes our Veterans Court that is in San Diego, with the Probation Department, Health and Human Services, obviously the Veterans Administration, and then several different nonprofit organizations that provide support. So we have a connection with our Veterans Village of San Diego. They're a residential drug treatment facility. They provide a lot of services. A lot of our veterans actually will go to that organization once they're released. We have Interfaith Community Services, which is a nonprofit that works in North County. They do a lot of things around housing and homelessness, and then we work very closely with the American Combat Veterans of War. This is a small nonprofit that is staffed by former military veterans. Some of them are young and some of them old, and what they've been able to do is they'll come in and provide some service in custody, but they also will provide mentorships in the community once people are released. You can go to the next slide, please. So we have a lot of demographic information. I just wanted to throw a few of the statistics. The average age is about 45. It's a little bit older than our overall jail population. The age range is anywhere from, like I said, 19 to 73, generally about 95% male, 5% female. Now, this is for our overall population of veterans, not the ones that are necessarily in the veterans unit. And then it gives you a little bit of the racial background of those individuals. So one of the things that we talked about was the VRSS, and we at our Sheriff's Department have a really big data IT department. So they were actually able to be able to automate the exchange of information between the VRSS and the Sheriff's Department. So there's feeds that go back and forth between these two. Before, you'd have to have staff that were actually doing certain functions. They took all of that staff time out of it, and now it is doing it. It's all automated. But what we're able to do on that is then we transfer that data into a tool called Microsoft Power BI. And we've just been able to do this, and that really helps us to be able to provide the information of the demographics and the data of the veterans that are in that unit. So we're just starting to really massage and see what this looks like, but it will tell us the average length of stay. It'll tell us the rearrest rates, the rebooking rates, different things like that. So we know that we have the ability now to really speak to the data and what does this population look like that are in our housing unit. The next slide, please. So I just wanted to talk a little bit. The sheriff talked about this also, the Justice Involved Veterans Network. This has been able to really help us to look at all of the aspects of working with veterans, whether in the treatment courts or whether in the jails or even with law enforcement that are having contact with people in the community. So I wanted to be able to provide that link. There's 3 different documents that have been produced by this group, and I think they're really informative to be able to have you have the ability to kind of look and see what other facilities are doing. Next slide. So we were very fortunate to have an evaluation study that has recently been published. This is by SANDAG, which is the San Diego Association of Governments. So what they did was they applied for funding from the National Institute of Justice. We partnered with them as well as the VJO to design what the evaluation was going to look like, and this was a 3-year study. So here are some of the outcome results as well as some of the recommendations by this. So the outcome was that 89% of the participants said that this prepared them, being in the Veterans Moving Forward program prepared them for reentry. We were really happy to see that this was their perception of being in the facility. 43% of the comparison group versus 1% had a rule violation. So in operating jails, this is a really big significant finding because one of the things that your correctional staff, they'll say, you know, one of the hardest things is to deal with people that are fighting with each other, that there's riots, there's disciplinary issues, and we knew that once we started the unit, we could see immediately the impact on the unit overall. So the sheriff had said that this is easy, you know, that this is an easy unit to run, and it's because the participants in the unit are very, very committed to the work that they're doing, and they will even self-select and say, you know what, this guy's not appropriate for the unit. He's not following the rules. He's not making his bed. So they really, the participants themselves, the vets themselves actually monitor each other. So the deputies or your correctional officers aren't having to do all of that disciplinary work. They don't have to write reports. They don't have to worry about using use of force, which are other aspects that they have to deal with on a daily basis in other parts of the housing units. So what was very interesting in our units, there's 3 actually units. They all share kind of the same vestibule area. They can't really see into each other. So when we opened the 2 units up, the other unit was our administrative segregation unit, and everybody was very worried that they were going to be disruptive. They were going to, cause noise or flood their cells or do different things, but we saw just the opposite effect. That housing unit, that was the administrative segregated unit, was the quietest one in all of the facility, because when they would come out for their day room time, they would sit there and watch and see what the veterans were doing. They were very respectful in what was happening in the other 2 units. They also, obviously, the outcome was the conviction rate. That's what everybody wants to know. Is this program being effective? And so what they looked at is they said the conviction rate for a new offense was 16% compared to 27%. So when you talk about recidivism, there's a lot of aspects that go into recidivism. It's hard to actually compare across systems in some ways. Different people have different definitions, and so we worked closely to say, okay, let's get a definition that everybody could look at, and so we looked at conviction for a new offense. So also the evaluation study, they had some recommendation. One of the recommendations was to increase the support for the transition in the community. This had nothing to do with necessarily, the work that's being done by the VJOs. It was just more of an impact of saying that we need to make sure that they have the ability to transition smoothly. Talked about a little bit about the volunteers that come into the unit, and then strengthening the partnership with the VA. Next slide. So these are just a couple links that you can go to. Video as well as the Sandag evaluation that I had referenced. And that's it for me.
Okay, hi, this is Angela Simoneau. So I will be talking about the VJO role in the Veterans Moving Forward program. We were working closely in partnership with the Sheriff's Department in preparing the program in the initial stages, going to visit the different vet mods across the country, as Christine had mentioned. So currently what we are doing is, as soon as the veterans are identified to us by the Sheriff's Department, we will go to the facility, meet with each individual one-on-one, orient the veterans to VA benefits and services, basically do a needs evaluation to determine what sort of things they need to help remove barriers to successful reentry. From there, we look at what things can be started while they're in custody. So we will start claims applications if possible. We can establish, get them loaded into the VA system, start applying for things like discharge upgrade and all that if they are in need of that, and then help them identify as well what benefits they may be eligible for. Not all of the veterans, as Christine had mentioned, we don't, they're welcome on the veterans module regardless of character of discharge, which also means some of the veterans are not eligible for the full range of VA health care. So a big part of my role is helping them identify, based on their length of service and character of discharge, what benefits they may be able to access. Some are eligible for the full range. Others may just be eligible for select homeless programs. So we want to make sure that they get whatever it may be that is there for them. Another piece of that is working with veterans who may have other than honorable discharge, work to apply for compensation so that they may be able to get health care and benefits related to service-related injuries. We also work with the Veterans Benefits Administration. We have a liaison from that side of the house come onto the unit twice a month to help with additional claims issues that may not be as simple as just submitting applications. So we also assist with the reentry planning and preparation for the VJO aftercare program, which I'll talk a little bit more about. Next slide, please. Thank you. So, as I mentioned, typically I will meet with the veterans as soon as they get on the unit, orient them to services, start working on things that we can. Within 60 days of their release, we have a whole range of people who are, some are unsentenced, some are serving 2 years, some are going to be released within a couple of months. So we really target within the last 60 days before the release, we start connecting them. I reevaluate the individuals to see what things may have changed. As they've been on the unit, they may have developed more insight into what their treatment needs are. They may have realized that maybe going back to certain old places may not be the best option. So I reevaluate the situation to see what sort of linkages are needed. And this is where I work really closely with the counseling staff at the jail to determine which programs they're going to be referred to. We have a really great support in the veteran support community where we have a lot of different programs that are willing to accept individuals from custody. I know when we started the VJO program in San Diego, really there was only one program that was willing to take a risk on our veterans coming directly from custody. And so, you know, our VJO team really went pounding the pavement from program to program, you know, getting to understand what the different programs were and also getting to help them understand the needs of incarcerated veterans. And part of this was able to transition successfully over when the Veterans Unit occurred, because then we had access for individuals to come in to do interviews for their programs individually. There's access to telephone at the counselor's desk where it removed a lot of the barriers that had existed for admitting people directly from jail. So the providers over the years have been very excited to receive veterans coming off of the Veterans Unit. They recognize that they have been voluntarily electing to participate in programming while they've been in custody. They have already developed some insight into some of the issues that they need to work on. They come out with a very strong reentry plan that they've been working on from the time they are admitted onto the VetMod. And overall, they become role models in new programs. So as we're preparing them for the release, we also look at other collateral needs that they may have. If they are eligible for VA health care, we're making their primary care appointments. If they are on Medi-Cal, we're helping them establish care through the family health centers in the community. Mental health, substance abuse treatment, making sure all of those things are squared away so that as soon as they are out, they can hit the ground running. They don't have to wait, 6 weeks for an appointment or whatever that may look like. Everything's kind of already set up within the first week or two of their release. And we also work on identifying what the aftercare needs may be, whether they need to apply for food stamps, general relief, get identification set up, follow up with the Benefits Administration. We kind of come up with a game plan for the first couple of weeks when they transition to the aftercare program. So next slide, please. So what we tend to do when an individual is leaving, I always say to the gentleman I work with on the veterans module, we wouldn't really be doing you a great service if we just waved goodbye and good luck at the door. They work so hard to develop a solid reentry plan with great goals, and the momentum and motivation is so strong that we really want to help them carry that forward and maintain that forward movement in the community. So that really begins with picking them up at the door as much as possible. We want to make sure that as much as we can, we pick them up, transport them directly to the treatment program so that there's no distractions in between. We've seen that if individuals are making their own way on public transportation, for say they may run into friends, and we tend to lose them. So pretty early on, we decided we would provide transportation as much as we could. And it also is another piece where we can build rapport with the individual during that time and really explain the services, and that, follow through with the promises of, yes, we will continue to work with you. And for a lot of veterans, they express that this relieves a lot of anxiety, because typically before, a lot of them are on or have been incarcerated before and have never seen a unit like the Veterans Module before, where they are provided with services. And there are people who are saying that, we're going to help you with the linkage as things, even after you leave here. So it helps to alleviate some of that anxiety. And then we provide case management. It's ongoing reentry support, basically following up with whatever their needs may be. We want to make sure that their treatment needs are still being met. If they are not happy with the treatment program they're in, we want to make sure that they're getting put into programs that, instead of just walking away and saying, I don't want to be in treatment anymore, helping to find a program that might be a better fit. And we really want, as much as we can, to stay with the individual until they are permanently housed. So we utilize our VA grant and per diem transitional housing programs as a first step from when they leave custody in many cases. And these are the programs, a couple of which Christine mentioned: Interfaith Community Services, Veterans Village of San Diego, and we have a few other contracts as well. So from there, what the individuals are working on with their team there and with our VJO program is looking at the next step, which is oftentimes utilizing the VA supported housing program, HUD-VASH, and where they would receive case management services in addition to a Section 8 voucher for housing. The alternative would be a program called the Supportive Services for Veteran Families, where the vets could potentially receive assistance with a deposit for an apartment and rental assistance and things like that. So in addition, we also help make sure that if they need to have continued advocacy for getting their benefits pushed through, figuring out employment, any of those needs as well, we try and wrap around them and make sure that they're finding the right resources for. And we also have a monthly drop-in group. So it's really for any alumni of the Veterans Module. It's really an interesting relationship that is developed among people who have been through the Veterans Module. Even if they weren't on the unit at the same time, they have a identification as being like-minded in terms of wanting to do better for themselves and be productive. And if they say at one program or in the group, I've been on the Vet Mod, they all know that they have kind of a common focus. So it's always, people will drop in and tell us, if they're struggling or if they're doing really well. Sometimes someone will come in and say, it's been a couple years, but now I just started my own business. I'm looking to hire some vets, and who's looking for work right now. So we really encourage the veterans to stay in contact as long as they want to. Sometimes, a few years later, they drop back in, and it's always good to see them. But especially in the beginning phases when they're walking out of the facility, we want to wrap around them as much as we can to make sure that they're getting all of their needs met. So that is all I have for today.
Great. Well, thank you so much, Angela and Christine, for your presentations. And unfortunately, we're just past time, but we had some great questions come in. And I want to remind people listening to the webinar that the panelists were kind enough to give their email addresses. So they're happy to follow up with folks about questions, or people can email me, and I'm happy to follow up with the panelists with the questions as well. But I wanted to extend a very special thank you to all of our panelists for being on the webinar today and for the great informational presentations. We recorded the webinar, and we should have it posted to our website early next week, so be sure to check back for it. Thanks again, everyone, and have a great afternoon.